dysfunction of the brain due to either lack of blood supply or bleeding inside or outside the brain. He understood that it's a disease that just incapacitates humans in no time. It just comes like a bolt from the blue and disables the individual. A minute before a stroke hits somebody, the individual has been perfectly normal, but immediately it disables the patient. We hear stories about people, like they were walking on the street, they had a shower, they were good, all of a sudden they collapsed. Heart disease doesn't kill people like that. A brain bleed can. So this is a devastating disease. There are lucky ones who have been, who come to our attention, we are able to treat them, thanks to the advancements in the medical science. From the time I did medical school, say in 1994 I joined medical school, at that time there were not much treatment available for stroke. And most of the patients who come with stroke, we just designate them as, okay, they are just going to go to Dr. Raj Prasanna rehab, we just treat them acutely, minimally, and then we just send them to rehab. But today, we have come a long way. Thank God I've been living through the stroke evolution treatment, and I've been part of this evolution, and we are able to offer much, much better treatment today and make them survive, not just survive, but to make them lead a normal life. And how this treatment is all possible, it's because of the advancements in medical science and the advancements in the education, medical education that has progressed over the last 2 to 3 decades. I will just take you through a briefing about what stroke is all about. Even if somebody survives from stroke, a good number of them survive with disability. Disability is not spoken about in detail in most situations, but disability is the most debilitating, devastating thing, not only for the individual, but for the family. Somebody who is disabled, just I'll give you a little briefing. If your hand and leg on one side is not working, just try to go home and try to do something, like just with one hand, try to wear a shirt. The day-to-day activities, having food, going to the restroom, coming back, without using one hand and leg or, partially limping. You just try that out. It's so difficult and it's so disabling. And this disability does not burden the individual, but the whole family, the caretaker. The individual, if he is hit with stroke at much younger age, what happens is he will be not productive for himself and for the family, and the caretaker too has to take time off. Unfortunately, unlike the Western countries, we don't have a good support system or the network to support people with disability. We don't have ramps in a lot of places. Our system is not well tuned to take care of people with disability. And this disability bogs down the entire family. It gives a lot of financial burden to the family apart from the time they spend. What are the types of stroke? Stroke generally is divided into 2 types. One is lack of blood supply to the brain. It may be a small vessel, a distal vessel, that may be just a harbinger of a major stroke happening later, and a part of the brain does not function. Or it may be due to a large vessel occlusion, a major blood vessel going to the brain getting occluded. There is also another type of stroke where a bleeding happens, a rupture in the blood vessel wall, maybe an aneurysm, or maybe because of the high blood pressure, uncontrolled high blood pressure, bleeding happens, and this bleeding leads to maybe a smaller bleed. The patient may survive with very minimal deficit, or a major devastating bleed like this within the brain can leave a person with disability for the rest of their life. This ischemic stroke, or the occlusion of the blood vessel, constitutes about 80% of the strokes, whereas this bleeding constitutes only about 20%. So a lot of large vessel, blood vessel occlusion, this is what the stroke we see. This is a medical emergency. Unfortunately so, like the heart attack, this is an attack on the brain. We call this as brain attack. We want to popularize the term brain attack. Unfortunately, this is a painless condition. A heart attack, somebody with a heart attack, unless otherwise they are a diabetic for a long time, they have lost the sensory nerves, invariably they have a severe pain and they get to the hospital. The pain is so severe. Heart attack pain is like putting an elephant putting its foot on somebody's chest. It's that severe, so they invariably get to the hospital. Whereas a stroke is a painless condition. They feel that I'm not able to lift my hand, that's it. Otherwise it would be perfectly normal. And they would just sleep over it. They wouldn't reach out to the hospital. So here we feel that an awareness of the public is extremely important. Somebody in the family, right from a school-going kid to an old person, should be aware if somebody in my family is not able to lift the hand, as having imbalance while walking, not able to see properly, when he is smiling, if his face is drooping, or if he is not able to walk properly, they should seek medical attention immediately. Immediately, in a sense, they should reach out, call the ambulance, not to even take other modes of transport, call the ambulance, because the ambulance is equipped with people who are trained to take care of these people. Treatment starts there, so they should be able to call the ambulance, get to the hospital immediately, and undergo the treatment as soon as possible. So, a large vessel occlusion like this, patient may present with the weakness of the hands or legs. Today, the treatment has evolved a lot. In the past, in 1994, we had only a thrombolytic medicine. We give a clot bursting medicine to burst the clot out, and then the blood flow would be re-established. But today, we've evolved to a level like we do for the heart disease. We go inside the blood vessel, we open up the blood vessel, we re-establish flow. Likewise, in the brain today, we open up the blood vessels, and we do it in the cath lab. And we are equipped, luckily we are equipped with all these equipments like in any of the Western countries. We are equipped with all the facilities, including the microwires, microcatheters, and we are able to offer this treatment immediately to these patients. How do we do this? It's an endovascular access to the brain. We go inside and access the blood vessel of the brain. Luckily, we have the road maps. That is, the roads are already formed. We need to go through them and re-establish the flow. We exploit the blood vessels of the brain, and then we put in these catheters. These catheters are small little plastic tubes, and they have variable stiffness. They are very stiff proximally. As it is more distal, they become very, very supple and soft. We put these catheters, we put this on the clot, and we aspirate the clot. Somebody has a clot sitting in the brain like this, we would put the catheter right at the clot. We would do a direct aspiration, we would remove the clot, and we would re-establish flow. So this way we are able to offer the treatment. There is also another way we do is stent retrieval. We have a lot of these kind of metal stents. These are nitinol based stents. Nitinol is a very interesting metal. It is used in aircrafts. It's a very lightweight metal. Aircraft manufacturing uses a nitinol a lot. They thought this would be better for the brain. And this has a memory. When it is, we can pass it through a small catheter inside and allow it to expand. It just expands with the body temperature. When it expands, it grabs the clot, and we are able to pull it out. So I'll just show you a short video of how this stent retriever works. Here is a clot sitting in left middle cerebral artery, and we pass a wire. These wires are as thin as a hair, and they have a lot of technology in it. We put a catheter across the clot, and then we deploy the stent. As the stent is deployed, we leave it for about 3 to 5 minutes. It expands with the body temperature. It has a memory. These metals have a memory. As it expands, it cuts through the clot and grabs the clot. And these struts are designed in the west coast of US by the Indian engineers. And these struts, when you pull, they have the ability to grab the clot and bring it out. So we arrest the flow and take out the clot. By this way, we re-establish the flow in the brain. And all this treatment has to happen within the first 24 hours. It doesn't mean that you have to wait for 24 hours. It means that as early as possible. A good number of patients coming within the first 4 hours, 4.5 hours, we will be able to literally get them back to the society normally within a few weeks of time. I'll just show you an example. Here, a patient comes with an acute stroke with a left side M1 cutoff. We do an imaging immediately. These imaging takes about 5 to 10 minutes, and we'll be able to diagnose them immediately. And this is how the clot is, actual clot. You can see here, this is actual clot removed. This is after we recanalize, this is before. This is just another case. I'll just talk to you briefly about how our system are geared up at Apollo hospitals, how we are geared up to handle this. Our emergency team is pretty good, and they are proactive 24/7, and they are ready to receive these patients immediately. And our ambulance network is also quite robust. They are stationed at different regions of the city, and they will be able to reach any patient calling for an ambulance, 1066, they will be able to reach. And within the hospital, we have defined phases of care to expedite the care. So nobody wants to talk to each other, it just runs like an orchestra. It just have to flow. The phase 1 is the pre-arrival phase, or the triage phase. The phase 2 is the pre-CT or the CT, pre-CT scan phase. That is when the evaluation of the patient happens. Phase 3 is the imaging phase. That is when the imaging, either a CT scan or an MRI is done. And the phase 4 is the time where the treatment actually happens. So we have targeted time for all these phases, 5 minutes, 15 minutes, 15 minutes, 20 minutes, which means that in about 45 minutes to 50 minutes, the treatment is designated and the treatment starts. I'll just run you through about how these phases work. The phase 1 is a pre-arrival phase. Somebody is calling the ambulance rushes to pick the patient. As soon as the patient is picked up, the ambulance guy calls the secretary in the hospital and he tells that such a patient is coming, and the secretary immediately alerts the emergency team. She registers the patient, hospital number, and then she alerts the stroke code. Stroke code means all the physicians involved are informed about the patient. As soon as the patient comes, the patient is taken care by the paramedics, and all the team members are informed that the patient has arrived. The second call goes to the entire team, including the pharmacy, radiology team, and the neuroendovascular team. And then the evaluation of the patient happens initially by the registrar of the emergency team, and then the nurse has a role. Everybody knows what their role is. They don't have to talk to each other. The nurse registers the patient, puts the IV line, puts the catheter, she gets the blood drawn, and then she does what she has to do. The registrar initially examines the patient. He then coordinates with the neurology and neuroendovascular treatment team, and then he tells them that this is the NIH stroke scale. For assessing stroke patient, we have a stroke scale. When we say somebody with a stroke scale of 4, somebody with a stroke scale of 15, we know what that patient, what the severity of stroke he is suffering from. For example, this patient is able to lift his right hand, left hand he is not able to lift. As you can see, this is the initial evaluation. The right leg he is able to lift, left leg he is not able to lift. So this is the initial evaluation that goes through. Immediately the patient is shifted for a scan to find the type of stroke he is having, because the type of stroke determines the type of treatment. So when somebody comes within 6 hours, we do what is called a CT with CT angiogram, which is a fast phase imaging. Somebody comes after 6 hours, within 24 hours, we have an MRI with MR angiogram, and we have a protocol. There today,